Let's all greet our honored guest, Katie Hill, and she'll be up here to talk. And by the way, when she gets done, there's a microphone up here in front. You can come up and ask Ms. Hill any questions that you so like.
All right. So my name's Katie Hill. Thank you guys for having me. First of all, I feel like this is way too formal. I normally like to sit around at a table and chat, but I thought I'd tell you a little bit about myself, and then I really am hoping that we can just have a conversation and talk about the issues that you care about and what you think I should know. I grew up here in the 25th District. I grew up in the Antelope Valley before moving here to the Santa Clarita Valley when I was 11 years old, so I graduated from all local schools. I am the daughter of a police officer, my dad, Mike Hill, right here, and a Canyon Country resident, and a nurse. My family is full of public servants going back. We have veterans in every single generation going all the way back to the Revolutionary War. Both of my grandmothers were nurses, and my mom, like I said, is a nurse as well. And I was planning on following in their footsteps, so I started nursing school right after graduating from Saugus High School. And I was working in the emergency department at the same time, and I had a few experiences that really led me to think that I needed to work on the issues before people ended up in the emergency room. So at the time I was 17 years old, and I ended up holding the hand of a 17-year-old gang member as he died and comforting his grieving sister as she told me about how he was a good kid and they bounced around the foster care system and he wasn't supposed to end up like that. So that was one of those moments where you realize that you're not able to fix this in the emergency room, and the systemic problems that we face are such that we have to deal with them further up the chain. And that's what led me into the nonprofit sector. I am, from there on out, for my entire career, I have been working in the nonprofit field. I am the executive director of PATH, People Assisting the Homeless, which is a nonprofit organization that works from all the way across California, from San Diego to San Jose, working to end homelessness for individuals, families, and communities. We literally help thousands of people who are living on the streets, including veterans, families, and chronically homeless individuals, move off the streets and into permanent homes every single year. So I have seen on the front lines where our society fails, and it's not just people who are drug addicts or who are mentally ill or who have been involved in criminal activities. It's people who have lost hope for various reasons, who have their rents have gone up too high, or they've lost a job and they don't have the family supports that will help keep them off of the streets. And it can happen to any of us, and I think that that's ultimately what led me to believe that we have to do better as a country and as a community, and that's why I'm here. So fundamentally what I believe is that, especially over the last several years, I think that on either side of the aisle we can agree that our political system has gone downhill. It is no longer representative of the people who are actually supposed to be served by our government, and is instead really a product of the special interests and the big money that guides our politics over and over again. And the decisions that are made in Washington don't benefit us. They all too often hurt us and instead benefit the people who are financing the campaigns and who are keeping our politicians there. So that's what I think we need to fix. And I think the only way to do it is to get new people in Washington who are not accountable to those special interests, and that's why I'm here. So with that, I really want to just open it up to questions, and I can answer. I am 100% an open book, so please ask me any questions you might have. Please, yeah.
Are you going to understand me? Okay. I am dealing with foster children, and I have learned this week so much about them. And in the county, for example, the state, nothing is done for those children who leave the foster home at 18 years old, Mm-hmm. And so I would like to know if you have something to provide to those kids if you are elected.
Yeah, so I think that the foster care system is a perfect example of where we do not provide nearly enough support. So once people, our foster care system in general is far underfunded. It does not have nearly the kind of resources to the people who are willing to be foster parents, but also the supportive services for the kids who have gone through massive trauma in their lives. to really ensure that they can be successful. They bounce around from not only home to home, which creates massive instability for people, but from school to school. And there's no consistency or ability for them to really deal with the issues that they're facing that ultimately lead to serious mental health issues, substance abuse issues, that certainly won't allow them to get into the jobs that they need, or the workforce, or or college, or anything like that. So I think we have to create programs that provide people the resources throughout that entire duration in the foster care system. And there are programs that are like that. They're often run by nonprofits. They're usually funded on a pilot basis, and those programs tend to get evaporated as soon as there's some kind of a budget cut, and we don't prioritize it. But I think that we also need to have that in a transitional basis from once somebody, because I know I have a younger brother. Once somebody turns 18, they are not an adult. They're not ready to just take over, their lives and be fine, even in the best case scenario, when somebody's had a fully functioning livelihood or childhood, but let alone somebody who's had that kind of a childhood where they don't have the supports they need. So we have to create transitional resources that really provide people with the resources to get into college or trade school, or any kind of opportunity that's going to allow them to integrate into the workforce and into society. And I think that that's absolutely possible, but we need to prioritize it, and ultimately it'll lead to our own, our entire community benefiting. Yeah.
Yes. If not, I can come up there. I was wondering, it takes a lot of money to run a campaign. Mm-hmm. Are you affiliated with any party?
So I'm running as a Democrat, but for me it's really important to not be about the party. I think that both parties have really failed to represent people that are in the middle, and that most of us don't feel represented truly by either party in the decisions that they've been making. So for me, it's about the issues, and it's about where I believe we can, the media and the political narrative has been pushing us further and further apart as a country. But here in the 25th District, where we are about evenly split between Democrats and Republicans, with a big portion of people who don't affiliate with either party, and that, by the way, that number is growing dramatically. That is, we show on a day-to-day basis that we can work together and that we can accomplish amazing things, and that we don't have to scream at each other the entire time. So I think that that's something that we have to bring to the national stage, and I think we can be an example of that here.
How do you feel about affordable health care?
So I have been personally affected by when healthcare is not available. In 2010, before the Affordable Care Act took effect, my husband and I were about to get married. It was the day of my bridal shower. He had just started a new job, which was it was before the provision took effect that employers couldn't put you on a long waiting period. So his new insurance hadn't taken effect yet, and he couldn't be on mine because we weren't married. And at the time, we couldn't afford, the private market health care. So he had a very short window where he didn't have health insurance, and he's a 26-year-old guy, thought he was healthy. It was a risk that, we thought we could take. But the day of my bridal shower, his lung spontaneously collapsed. And it's called a spontaneous pneumothorax. It can happen to young, healthy people, and there's no real reason behind it. There's no family history of it or anything. But he ended up being hospitalized and having emergency surgery, and we ended up $200,000 in debt. So that is something that can destroy people's lives. We were young. We didn't have a house that we could lose. Our families were able to, help us, and while our credit recovered, my dad had to co-sign on a car for me, way later than I would have liked in my life. But I think that that's something that is a perfect example of why we have to make sure that people don't ever have to make the choice between getting the care they need and putting a roof over their heads or food on the table. And fundamentally, whatever choices we make as it relates to healthcare, I think has to align with that value. And I think that that's not inconsistent with our ability to be fiscally responsible and make sure that the system is working for everybody and is affordable for everybody, including us as taxpayers. So,
how would you do that?
So I think there's a few things. If you were looking at the Affordable Care Act the way that it is, it's okay. Yeah, I'll be here as long as you all want. So I think that there's a few things that we could do if we were looking to fix the Affordable Care Act. One is we have to get more young, healthy people into the exchanges, which is why they've been collapsing in many states, is that there's people who are sick and who are older who are getting onto the exchanges, but who are not enough people who are young and healthy and who would not be using it because the monthly premiums are too high. So one of the unintended effects of having that provision where people can stay on their parents' insurance until they're 26 is that that's a big chunk of people who are young and healthy and who would otherwise be in the exchanges. So if we can, but it also, the robust plans that many employers have for regular adults aren't really needed for people who are young and are barely going to go to a doctor once a year, if at all. So a simpler plan that has basic coverage but doesn't necessarily have the same kind of minimal copays and everything like that would be sufficient for somebody who's 18 to 25. So if we incentivize, instead of parents keeping them on their employer's plans, if we incentivize them with a tax break or with a tax credit or something like that to pay for their kids to be on the private market, it may even be cheaper. Their employers wouldn't be paying it. In some cases, the parents are even paying out of pocket. Just it comes out of their paycheck, so they don't really feel it. Then we would be able to get a large number of young people onto the exchanges, and that would have a dramatic impact really quickly without negatively impacting pretty much anybody at all. So I think there are a lot of simpler fixes like that. I think we also have to look at, I think that the healthcare industry is one that is really the only thing that we all sign blank checks for. We go to the doctor and we authorize a procedure without having any idea of what it's going to cost us, and we just sign away on that. And I think that that's something that we have to create more transparency. We need to look at how pharmaceutical prices are regulated, and right now there is virtually no limit on how much money a pharmaceutical company can make off of the cancer drugs that they're selling us and charging our insurance companies and people out of pocket for. I also think that there are built-in incentives right now for insurance companies to hike up and be willing to pay for services that are overinflated. So, for example, we've got we set a limit on the amount of profit that an insurance company can make. We made it, with the Affordable Care Act, we made it so that most insurance companies, for most plans, have to pay at least 85% of everything that they take in premiums into healthcare services. So that means that there's only a 15% amount that they can spend on administration and on operating the health plan and so on. So if you have $1 million in premiums and you can only spend you have to spend 85% of it, that's a very small amount that's left over for them to do anything else, let alone make profits. So what they need to do to be able to make more profits is increase the overall amount that they're spending. And we have to create disincentives for them to be willing to pay higher prices for healthcare if we want to reduce the overall price of healthcare overall. So I think that those are some of the ways, but frankly, I could go on for a long time. So, yeah.
Ms. Hill, I'm
Sir?
Randy Munyon. Tax reform is in the air again.
Yep.
American corporations complain that the federal income tax corporate rate is 35%. This is way higher than the 20% which you find more typically in Western Europe and other countries. But if you take into account the deductions and credits, the effective tax rate on American companies is actually in the low 20s, much closer to the 20% elsewhere. In considering federal corporate tax reform, rather than focusing on the rate, isn't it more important to look at the structure of the federal corporate tax code so that American corporations can't simply reincorporate offshore and escape most or all of their federal income tax liability?
Yep.
Or the carried interest loophole, which permits private equity fund managers to be compensated at capital gains rates rather than the ordinary income like the rest of us.
So that's one of the biggest ones that I have a huge issue with. When I first learned that people who are so well off that they are living off of interest alone in their investments are able to pay half of the income tax that most of us pay, which is a third of our income, I thought that had to be wrong. That could not be accurate. So I think that that's one of the easiest ways that we could drastically increase our revenue to spend on things that are important to us as a country and as a community, by just making people pay their fair share. We're not asking for them to pay more than what we are. We're just asking for them to pay the same percentage that we are. That's not saying that we're, disincentivizing people from, pulling themselves up by the bootstraps and becoming successful. It's just saying that if I have to pay a third of my income in taxes, or any of you all have to pay a third of your income in taxes, then those people on Wall Street should as well. So I think that that's absolutely correct. I think the same goes for corporations. This goes back to the influence that those special interest groups and the wealthy have on our elections and have had for way too long, because I can tell you right now that those are the phone calls that our Congress members take. They're the ones that are financing their campaigns, that are ensuring their reelections, and that don't want that tax code to change to the point where it's benefiting the rest of us and not the ones that are currently benefiting. So. Question back there.
Katie, what are your thoughts on student loans and the very high cost of tuition that's happening in our country?
Yeah, so that's an issue that deeply affects my generation, clearly. I have many friends that are well into six figures of student debt and are barely able to get a $50,000 a year job. So they are not able to pay down their debt, let alone, put money towards a house or towards anything else. Right now, they're, still in many cases living with their parents or barely making ends meet, renting with several roommates. So I think that that's a fundamental problem with our system, and that, frankly, my family wouldn't be in the middle class if it weren't for the opportunities that were afforded with affordable education. Both of my grandfathers came from poverty. One of them was from a farming family in Idaho. The other one was from a railroad workers in Oklahoma. And brilliant men. Both of them knew that if they wanted to get out of that situation, they had to get out of there. And the only way to do that was to join the military. So both of them did, and that was what paid for them to go to college. And one of them ended up going to Princeton and becoming a UCLA professor in poli-sci, which I can get into. That's part of why I'm here. And then the other one ended up becoming a rocket scientist and worked on the space shuttle and many other of our projects that got us, to where we are now. So I think that that would not have been possible if it weren't for the opportunities that they had because of the education that was free because of their service. And I think that that's a model. The GI Bill and ROTC are similar models that we could look at that doesn't have to be military service, but it could be kind of community service, that we can ask people, students who can't afford college but want to work and are willing to work and put skin in the game, to sign up for something like that and to work in, whether it's in our inner cities or in environmental projects or in infrastructure projects, and then they'll earn a way to pay off their education. And I think that those are models that already exist and that we can very easily replicate and expand upon. Also, just real quick, and then you definitely need to go because you've had your hand up for a while, but I think that we need to regulate how much interest rates are charged for student loan debt. I think that that's a huge issue, and it's something that when, again, profits are being made off of things like this, then there's fundamental problems with it. So, yes, sir.
Okay. Douglas Fraser, can you explain a little more what PATH is, how big it is, or how many communities it involves? And also, is this your first run at a political office, or have you tried before?
Yeah. So PATH is about a $50 million a year organization. We have grown since I've been there, since 2010, from a $5 million a year organization to a $50 million a year one. 75 employees to about 400 employees. So it's been pretty rapid growth. It's in response to communities that are really recognizing the need to address homelessness, as well as in increased investments by those communities and willingness to invest in the best practices that we know we have to be able to really deal with homelessness. So we've grown a lot. We used to be all in LA County, like three sites, mostly shelter-based. Now we have more than 25 locations, all the way from San Diego to San Jose, and we continue to grow. So it's something that we're fully focused on the mission, and so we'll continue to grow as long as the resources are there and the need is there, until homelessness is dealt with. So, and then in terms of my own experience, it's my experience that I believe I'm bringing to public office is not in running previously. It's from running an organization and helping an organization grow, and in building community support for large-scale initiatives at both the state and local levels, and in community organizing. And I think that that's something that is, and frankly, leadership is missing in Washington right now. And I don't think that many of the qualifications that often go into political office necessarily prepare you for what needs to be done. So.
Hi, Katie. Gene Dorio. I'm a physician here in Santa Clarita. And, more and more seniors are becoming homeless. And I think our last count, we had 13 seniors who are homeless here now.
Yep.
Through your organization and through government, how do you intend to keep our seniors off the street and have a home to live in?
Yeah. So there's several issues with that. The first is that Social Security has not kept pace at all with the cost of housing, particularly in communities like here in California. So as long as rents continue to rise and vacancy rates go down, then homelessness is going to increase. And when you have people who are on a fixed income, like seniors, then they're going to be heavily hit. And we see that. We have dramatically seen senior homelessness increasing over the last several years as, ironically, as the economy improves, then that's often when you see homelessness get worse. It's sort of a counterintuitive idea because that's when the housing market gets tighter and tighter. So we have to increase housing affordability and really deal with that. And I think that there's many aspects with the production of housing, and particularly dedicating it to low-income seniors is something that's absolutely critical. Something that I worry about a lot is the fact that the baby boomer generation is simply not prepared for retirement. The pensions are not there that were there for the previous generation, and we are not. My parents, my dad has a pension, my mom doesn't, but that's something that is going to be a major issue when Social Security alone is simply just not enough for people to get by. Certainly not here in Southern California, and we have to really look at that from a holistic approach of what are we doing as a society to make sure that there's a safety net in place, and that's a really involved process, but it requires an investment. So
how about Measure H? We had the conversation at COC, and some of that money is going to be, we're putting in, I think Alan said $7 million, and we should recoup some of that, but here in Santa Clarita, we don't, we had an ad hoc committee with the city, but I don't think there's anything that's organized to try to get that money back. And of course, I would like to see some of that money prevent seniors from becoming homeless. So how, your organization is going to be a part of trying to get the money to help do what you do, but how do we in this community work to try to get the
resources
money
here
back to this city?
Yep. So it has to be political pressure to ensure that remains a priority. The way that the resources are going to be allocated is based on the homeless count. So that is a count that's done now every single year in January, and the results of this past count are going to be released in the next month. So we'll have a better sense on, within a few weeks of what we're looking at in terms of the percentage of resources that are going to be coming to this service planning area, which is, Santa Clarita and Northern LA County. So that's something we need to do, is really make sure that the homeless count, when it is happening in January, that we provide the volunteers to really count every single census tract and make sure that we are accurately reflecting the number of people who are homeless here, because that's one of the things that can skew it and ensure that we don't receive the adequate amount of resources, is because if people are hiding, let's just say they're in the wash, and we don't have the right number of volunteers to go look for them and say, no, there's 15 people who are living in this encampment in the wash, then those ones will just go uncounted. And then the way that the data is calculated, if you miss some of those, then that gets extrapolated out, and it can be be a pretty tremendous impact on the overall count for a community. So I think that the city now can start planning to be, how are we really looking to make sure that we're going to be engaged in the homeless count next year, and how are we going to make sure that we are counting every single census tract, that we have a by name list of everybody who's homeless here, so that we can ensure that that's cross-referenced against what we know exists on a day-to-day basis here. And the nonprofit partners that are here, like Bridge to Home and many of the others here, are going to be critical partners as we continue to move through this effort. So Mayor Smythe convened that ad hoc committee and is really open about what it's going to take to ensure that there are resources around housing and making sure that we can deal with it here in our community. So I think that making sure that that continues to happen and that the discussion continues to happen is going to be critical, as well as keeping the pressure on, let's just say, Supervisor Barger to make sure that our community is getting its fair share in terms of the number of people who are homeless here is going to be important.
Should there be emphasis on seniors, families, certain groups of people that, are more susceptible to when they're on the streets, that they're going to have a lot more problems? Do you folks have that priority system set up already?
Yep, we do. Okay. The system is actually, this is something we've been advocating for a long time, that it's called a vulnerability. Basically, it's a tool that assesses people based on their vulnerability and their need. So the way that people are prioritized for services is based on factors including age, including medical history, and many other factors like that. So people who are seniors are automatically put to the top of the list in terms of priority, and that happens across the county. So that's something that is already embedded in the system that Measure H is going to use, which is something that we fought really hard for. Same with families. Families are, we have a tremendous amount of resources that are going to families. We've already seen just in the last few years since we've invested many of those resources, we've seen a pretty substantial drop in the number of homeless families. And we've also seen a drop in how long families who are experiencing homelessness have to stay unsheltered or without receiving help. So we're able to help them, more of them, as well as help them faster. And that's something that hopefully with Measure H we'll continue to see that decline. One thing I will say with Measure H, though, that we have to be aware of and continue to work towards as a community is that if you don't have the housing and if you don't have the landlords who are willing to rent to these people who might have bad credit or tarnished rental histories or need opportunities, then all the resources that you're able to provide may not be enough, because we have to be able to provide the housing. So I think that that's an area where this community can really rally and be able to contribute to it, is by helping to mobilize landlords to be willing to rent to people who are coming through this system, and that's what it's going to take. So,
do you think that number is going to continue to increase, that we're going this way with the numbers and more people are going to become homeless? Is there an end that you see in any of this at this point? Because we're going to be getting the tax in, but what if it just overwhelms the taxes that we do get in? How are we going to? You're putting the graphs out there saying here's the progression. Has it peaked yet, or are we really looking at something that is hopefully going to start going flatline and go down pretty soon?
Yeah, so I think that this investment of resources is going to have a big impact. There's no way that it won't have an impact, but there are some structural issues that we have to deal with at the same time and just kind of mitigate our expectations. We're not going to be able to end this homelessness crisis that's been building for decades overnight with an investment of $355 million a year. It's just not. It's a lot. It sounds like a lot of money, but it's not in comparison to how long we've been failing to deal with this in a major way. So it's going to really provide a lot of the resources and the services that we need to be able to really make an impact. But at the same time, we have to constantly push on how are we really tackling the housing affordability issue. And that is something where you can't just build more market rate housing, because we live in communities that are going to attract people from all over the country. So if people with means are the ones that are coming here, we'll never deal with the affordability issue. So we have to create housing that is set as affordable for people who would otherwise not be able to live here. And that's something that Prop HHH in the city of LA is really designed to deal with, but we don't have a comparable initiative that was countywide. We have a portion of Measure H that's going to deal with building housing throughout the county, but that's something that has to happen. Those investments have to happen community by community, including here in the city of Santa Clarita. It's something that we should be doing.
How would you recommend that we put pressure on City Hall to take advantage of the monies that will come in? What can we do? I mean, sometimes, they had a meeting and they invited certain people, but, maybe they should have had the meeting and invited certain people, but for us who were interested, could have sat on the sidelines and hear what they were talking about. But that didn't happen. They had the meeting, and it seemed like it was almost behind closed doors. How do we affect?
I think you should ask for a meeting to be public, and I think that that's something that they would probably be willing to do. Yeah. They planned it that way? Yeah, I don't know. I was at the meeting, but I didn't have anything to do with planning it. But I think that Mayor Smythe is actually pretty committed to this, and he's very open-minded about what it's going to take. So I think making sure that the city council is aware that this is something that you all are paying attention to, and that it's something that you're not going to just kind of, all right, well, the tax is happening and we're kind of resigned to it, and now, just sort of check out from it. So I think saying, okay, you had this committee meeting, now what? And what's the next step? And when's the public meeting? And what are we going to do about it moving forward? I think that asking those kinds of questions and keeping the pressure on is what will ensure that it keeps moving forward. And, I think that there were some great ideas that came out of the meeting, including having a landlord summit, including really talking about what it would take to build some housing units here that are specifically dedicated to people who are coming out of this system. That's what's going to ensure that those resources come here to this community, is making sure that we can actually use them here in this community. So I think that really continuing that dialogue is what's needed.